You want to close them down? Okay.
Yeah. We're all the way up here.
Okay. Whenever you're ready, Dave. Okay, is everybody ready, you guys? Okay, thank you for coming. The three people who will be talking today are the illustrious State Representative Matt Pierce from Bloomington, Bev Morovich, who is President of Compassion and Choices of Indiana, and this gentleman is Corey Poland from Brownsburg, who has an interesting personal story to tell. They will be available afterwards also, I believe. Is there a Christy Soper in the house? She will be available as well. There's a Connie Campbell here. She probably got stuck on the traffic on 465.
Christy's from Auburn for any Northern Indiana meetings.
Yes. We have handouts at the end of the table there that we encourage you all to take. I do have copies of the bill being made, so just stop by our office afterwards and we can provide you with a copy of the bill. There's also a press release. We'll hand that out after these guys yak. So, Representative Pierce, the floor is yours.
All right, thank you, John. I want to announce today that I have filed House Bill 1157 to give Hoosiers the same end-of-life options that have existed in Oregon for almost 2 decades and have been adopted in Washington, Colorado, California, Vermont, and the District of Columbia. And my goal in introducing House Bill 1157 is to start a conversation between legislators and their constituents about end-of-life issues, which are always difficult to discuss. So what I want to do is just take a quick run-through for how the bill actually works, and then we can hear from our other speakers with their views on the bill. So anytime you talk about a bill like this, people are being concerned about, can it be abused somehow? Will people be coerced into ending their life early when they wouldn't want to, or perhaps don't have a sound mind to make a decision, good sound judgment? And the bill that I've introduced based on Oregon for almost 20 years has a number of safeguards built in that ensure that it truly is the decision of the person who's facing the terminal illness as to when they would end their life. So I just want to run through very quickly. There are basically 10 steps, and even within those steps there are kind of sub-steps. But just to give you an idea of the checks and balances built into the process for someone who wants to avail themselves of this option. First of all, you have to be diagnosed with a terminal illness. That means a disease from which there is no recovery, and the doctor must give you a prognosis of death resulting within 6 months. Now, if you're interested because you have concerns about dying in a humane and compassionate way and you'd like to take advantage of receiving medication that would allow you to die on your own terms, you would have to file a written request on a form created by the Department of Health. It would have to be witnessed by 2 disinterested witnesses, and they would have to attest that the patient requesting the medication is competent, acting voluntarily, and not coerced. The attending physician would then have to also determine or certify that the person has a terminal illness, that the person is competent to make a decision about their end-of-life options, and that the request that has been made was made voluntarily. Now, at this point, the attending physician would have the requirement to provide alternatives to the patient, such as pain management, hospice care, also discuss the potential risks and probable results of medication. Is that my mic getting a little better?
Yeah.
Let's try this one. It's much better. I don't know what happened there. All right, maybe that's a little better. So once a written request is made and witnessed by 2 people as to the competence and voluntary nature of the request, the doctor would then make sure that there's informed consent on the part of the patient, so there would be discussions about the potential risks of using the medication and alternative treatment, such as hospice or pain management. And then if the attending physician thinks it would be beneficial, they do have the option of referring the patient to counseling, so they can further explore what their options are and what might be the best approach. Now, once that is completed, there's a 15-day waiting period. And so there's a period of time to reflect upon the request and the decision. At the end of that 15-day period, the attending physician then must ask the patient if they want to rescind the request. It's basically, are you sure you really want to go down this path? If the patient says, I want to continue to pursue this option, then a second written request is required. At this point, a second physician, a consulting physician, must be brought into the process, and that physician will examine the patient's records, examine the patient, and they will confirm the diagnosis of the attending physician. They'll make sure the patient is competent to make the decision and that the request is voluntary. If either the attending physician or the consulting physician, either doctor, concludes that the person is suffering from depression or some other psychological disorder that might be clouding their judgment, they must refer the patient to counseling at that point. And then the counselor must certify that the patient is competent and not impaired so they can make a voluntary decision about how they want to proceed. It's only after you get through all of those steps that the attending physician may then dispense or prescribe the medication that must be self-administered. So this is another important point about this bill. No one else can administer the medication to the patient. They must do it themselves. And the bill specifically says that any person coercing someone into this, administering the medication with the intent to cause the death of somebody, that would be a level 1 felony. So you're kind of the equivalent of murder. So there are lots of safeguards built into the bill, and it's made very clear that it must be the decision of the patient, and the patient must administer the medication. So those are the checks and balances that are built into the system and are included in the bill. So with that, I'll turn it over to Bev Morovich, who will talk on behalf of Compassionate Choices Indiana.
So Compassionate Choices at a national level works to ensure that all individuals know the options available to them when they're facing treatment or end-of-life decisions from a terminal illness. So a lot to the point that you're making about educating people about this. This is also about getting doctors and patients to fully discuss end-of-life and treatment options during a terminal illness. We already have several options in Indiana: hospice, palliative care, voluntary stopping and eating. But those options don't meet everyone's needs as at the time a terminal illness occurs. What we find when we listen to people with terminal illnesses is that they yearn to live as long and as fully as they can for as long as their disease allows them a reasonable quality of life. What they don't want is a prolonged and painful dying process. And so this is why Compassionate Choices of Indiana wants to see this legislation adopted in Indiana to save people from unnecessary suffering and allow them a more peaceful dying process. Medical aid in dying exists in 6 states. Oregon has had it for 20 years, but Washington, California, Colorado, Vermont, and Montana also have it, as well as the District of Columbia. And we want to see Indiana added to that list. Oregon's had this legislation for 20 years, and during that time there have been no instances of abuse. But there have been some improvements in the end-of-life care overall. Oregon now has one of the highest utilization rates of hospice care in the nation. More people die in their homes in Oregon than in any other state. And the terminally ill people report a calming effect that relieves worry and anxiety at just having that option available to them. The number one reason those seeking the prescription in Oregon give for wanting it is autonomy and control over how their life ends. Yet 1/3 of those who seek the prescription never fill it. This supports the fact that this is about having the option. Another reason we favor such legislation is that public support is growing. There were 3 surveys conducted between 2014 and 2016 that show support by close to 7 in 10 Americans. Gallup's Values and Beliefs poll in May of 2016 was 73%. Lifeway Research in 2016 at 67%, and a Harris poll in November of 2014 at 74%. These surveys cut across demographic groups by age, generation, religious affiliation, and even political affiliation. Surprisingly to me was the fact that Republicans showed support at 64%, while Democrats and independents were at 78%, clearly a majority in all cases. Even support among physicians is growing, as seen in a Medscape poll in the fall of 2016. This was an online survey of 7,500 doctors nationwide, and they agreed by almost a 2-to-1 margin, 57% to 29%, that provided there is no shred of doubt that the disease is incurable and terminal, I would support a patient's decision to end their life, and would also want the same option available in my case should the need arise. We respect the right of anyone to decide this option is not right for them, and even to think it's not right for others. However, we believe one person's beliefs or moral values should not prevent another person who does not share that belief from using this option. We need to further educate the public on this issue, get more conversations started. We need individuals to be talking to their representatives and senators about where they stand on this issue, and we need to continue to work toward passage of legislation in Indiana. Legislation that just provides one more end-of-life option for those individuals facing death due to a terminal illness. Thank you.
Okay, I'll turn it over to Corey.
Thanks, Matt. Thanks, Bev. I'm not a career public speaker, so I've prepared some words. I value everybody's time here today, so this will keep me on topic. I'm a husband, father, uncle, brother, son, and coach. My life has been very blessed, but that does not mean it has not been rough. I've graduated college and married my sweetheart. I have 3 wonderful children and a great career, paid my taxes, and stayed out of trouble. A decade ago, I witnessed my dear young mother battle and succumb to colon cancer at the age of 50. A couple years ago, I began my own battle. I have ALS, or commonly known as Lou Gehrig's disease. This is a terminal, progressive neurological disease. You may have heard about the Ice Bucket Challenge a couple years ago and even participated. While it brought great attention to the disease, it still remains a fact that there has been little to no progress in treating, much less curing this disease since Lou Gehrig announced having it in 1939. There is no sugarcoating any part of this disease, and doing so is an injustice to those before me. My future is not a nice one. Knowing what to come is torturous. It's a future that is worse than what we label as torture for our military. The state imposes compassionate death penalty for the worst of the worst criminals: murderers, cop killers, and terrorists. Timothy McVeigh, who killed 168 people and injured over 600 in the Oklahoma City bombing, was put to death compassionately in this state. Why did he get to die compassionately? Yet Indiana wants me to have a torturous death in front of my children and my sweetheart. I don't understand. Regardless of one's personal decision on aid with dying, the liberty to choose for those affected will bring great comfort and solace during an agonizing time. Just knowing that this option is available takes an immeasurable weight off the shoulders of patients like me. To know I could have some control in the amount of torture I and my family endure would be priceless. So today I stand with Representative Pierce, even though my representative has chosen to ignore me. Representative Pierce is leading the cause of bringing dignity and liberty to patients like me. Oregon's Aid in Dying law recently had a 20-year anniversary. Other states like Washington, California, Montana, Vermont, Colorado, and District of Columbia have all followed suit. In this great country, our liberty should not be dictated by the zip code for which we live in. These laws have been overwhelmingly successful and are working as intended. Laws like these have majority support across many demographics. This is a great opportunity for Indiana to lead. I ask every legislator to also support this bill and bring it to the floor for a vote. Thank you.
Questions?
Matt, how does this legislation coincide with some of the, in a lot of jurisdictions there have been laws sort of quote-unquote against suicide, making it like a misdemeanor or felony. How do you reconcile this law with that legal theory?
Yeah, I think most of those laws came out of the Dr. Kevorkian situation, if you remember, up in Michigan, years ago, where he was the person administering that. He was an ardent advocate for, actually administering the medications. And I think that made people very uncomfortable, and they were concerned that people might be getting coerced, or perhaps they didn't have the mental capacity toward the end of their life to actually make their decisions known. And so I think a lot of legislators around the country responded to that particular scenario. What we've seen in Oregon for nearly 20 years is it's nothing like that at all. Clearly the choice is put in the hands of the patient, and there are many, many safeguards to ensure the patient is carefully thought through the ramifications of the decision they're making, and that you have consulting physicians to make sure that the person is making the decision based on their best judgment and not because they're suffering from depression or some kind of psychological disorder.
Representative Pierce, this state, at least the state legislature, is not a big fan of choice when it comes to health care. What do you think the chances of this bill are?
Well, one reason why I want to introduce the bill is we need to have the conversation. And I think that based on the polling that's been done, if you really talk to constituents, Hoosiers, they want people to have these options. They want to help people in this very difficult situation. And I think that legislators need to hear that, because I think most legislators recognize there's some controversy around this type of bill, and quite honestly, they're nervous about getting out in front of it. So what has to happen is the people have to lead. I've often said, which makes some people angry, that legislators are not leaders, they're followers. We're very good at following what is the will of the people once we figure out what it is. And it's not very often that we get out in front and point the way. And so what needs to happen is the people of Indiana need to point the way for their legislators on this issue.
Well, do you think this has an honest chance of survival and becoming law in Indiana?
I think it can become law. It may not become law in this session. It is a short session, time's tough, but I think that the more we have debate and discussion around it, the more the media reports on it, the more people communicate to their legislators, I think we can begin to make progress and get more people to be willing to sign on to the bill, to kind of move forward on the issue, give the bill a hearing, begin to discuss it, and meet people's legitimate concerns about how this process might work.
Corey, you said you were ignored by your representative. Who is your representative?
It's Greg Sturwell.
What is the actual prescription, if you will, and how does that work and administer?
I don't have the details on the actual medication. That's up to the physician, I think, and the medical people who know much better than I what that would be. It's not addressed in the bill as to what the actual medication would be.
What is it in Oregon?
It's typically, there's a couple barbiturates given to you to keep you from having nausea and being ill, and then a sedative that is the actual pain-killing drug, and sometimes it's several drugs.
You take it once orally and you die within how soon?
I honestly don't know that level of detail.
Yeah, I think it's about a 3-hour process.
And is the oral prescription?
Yes, yes.
So is this a drug that we're talking about? I realize we don't have a specific one, but is this something with an existing medical use? I guess what I'm driving at is, why is there a need for this law? Why is this not something that patients can decide on their own without the medical community getting involved?
Well, I think it's because I have a suspicion that in many cases doctors are helping their patients in this situation and are just not making it known to people. And so that's because there's no legal structure, and you have to provide the doctors with civil and criminal protections. So if they help someone with an end-of-life option, they're not accused of violating existing laws or their medical ethics. And so we have to have those system in place. That's why at least out in the open it can't happen now. But I suspect, I've heard anecdotal stories about doctors helping their patients by providing them with medication that will ease their death, but obviously not advertising it because it's a gray area in the law right now.
Matt, do you worry or have any concern that, obviously during session, the issue comes up, those quote-unquote divisive social issues. We already got one lawmaker introducing a bill that would basically eliminate all abortions under any circumstances. Now we have sort of the end of life. Any worry that this would be labeled under that category? So, like you mentioned, people do have really strong feelings about this.
Right, I do have a concern that it could kind of descend into that, but I think that the more we hear from people like Corey, the more we hear from constituents across the state will realize that this is really in a different class, and I don't really look at it as a divisive social issue. I mean, every end-of-life issue, we're not, as a society, we're just not very good about discussing them and coming to grips with them, whether it's, how long you stay in life support in the hospital, or what kind of efforts you make to prolong your life when you have terminal cancer. I mean, a lot of these issues are very difficult, and even families are not very good at discussing them on themselves. So it's a difficult issue in a public policy forum. But I think that again, if we hear from the people and the people help lead the legislature, then I'm convinced we can have a good, solid civil conversation about it and make a good decision.
Representative Pierce, are any state medical groups on board?
I have not heard from any yet on this.
Have you heard from any saying we wish you wouldn't do this?
I haven't heard directly from anyone, no.
Anything else?
Yeah, one more. In 20 years, there's only been 5 other states that have followed Oregon's lead. If the support is that overwhelming, why is that?
Well, I think that it comes down to in each state you have to have some legislators willing to step forward and handle the issue. And the truth of it is, if you look at even Oregon, it's a very, very small subset of the population that needs this help. And so quite honestly, it's easy to just kind of ignore the issue because it's not as if we have a lot of people throughout the state that need the issue. It's a very small number of people, but they're people who deserve the help of the legislature. And so I think that's why there hasn't been a big push in the state, because you just haven't had, it's not like everybody drives the road so they have an opinion about potholes or liquor on Sunday, whatever the issue of the day is.
I was going to ask you about that.
Yeah, so I think that's why you haven't seen a lot of states moving forward on that.
Thank you, everybody.
Corey, could I have you guys say and spell your name?
You spell it?
Yeah.
Coreypolen.
Pronounce it for me.
Corey Poland.
Bev Marovich, Hmurovic,
And your title again?
President of Compassionate Choices of Indiana.
Fair enough. Thank you,
Great.
everybody.
Thanks, everybody.